used for all the drugs in the future for Nigeria and for the rest of the continent, as you mentioned. So thank you very much. And the next speaker is Andrea Vassalotti. So she is the Director Partnership and Program at the World Heart Federation, in Geneva. Talking about heart, she's also a topic which is very close to our heart at GS1 as well, the Vice Chair of Fight the Fake Alliance. And she's going now to tell us a bit more about this NGO, which has been formally set up this year, but had since a long years working informally on making sure that patients would not be exposed to falsified medicines. Andrea, the floor is yours.
You're still muted.
Okay, here I am. Sorry about that. Yeah, you got ahead of me, so I'll just boot up to my first slide. Thank you. Well, thank you very much for that very enthusiastic welcome. First of all, I'd like to introduce myself, as Geraldine said. My day job, so to speak, is to be the Director of Partnerships and Programs at the World Heart Federation, but I'm also very proud to have been elected Vice Chair of the new Fight the Fakes Alliance. So we'll be talking a little bit more about this. It's a group of 16 member organizations, of which GS1 is a proud part. And these organizations come from all along the supply chain, and we formed this alliance in order to work collectively on the growing global burden of substandard and falsified medicines in order to safeguard public health and strengthen health systems. So it's a problem that is really under-addressed, and I'll be talking a bit more about this today. So a bit more about my organization, the World Heart Federation. So we are really the unifying force behind the global cardiovascular community as we focus on advocating for heart health for all. Our role as the only global organization that has global relations with the World Health Organization. So that puts us in a very special position to be able to elevate the priority of what is the world's #1 health challenge, cardiovascular health. As a founding member of the Fight the Fakes Alliance, WHF is committed to addressing the issue of falsified and substandard medicines and really increasing the level of awareness. So as an organization, you can see we have our mission is really in 3 parts: to connect, lead, and inspire the community, but also to translate what is complex science into policy. And that policy connection will be extremely useful for Fight the Fakes. So that's really what we have to do is get our message to be heard by policymakers worldwide. So why fight the fakes? So very frightening statistic here. According to the World Health Organization, substandard and falsified medicines are a major global health issue, but low and middle income countries carry the greatest burden, with 1 in 10 medicines being fake. So really, really awful situation here. But what are falsified substandard medicines? They're basically medicines that don't meet quality standards, and they've been manufactured and distributed illegally, often by criminal organizations. They have little or no active ingredient, and they are deliberately and fraudulently misrepresenting their composition and source. So through this, it's hard sometimes to understand the problems just hearing a single statistic. But this the fakes really expose people to a lot of risks. Not just patients, but also communities and governments are carrying that burden. And what's increasingly worrying is that there's antimicrobial drug resistance, which is caused by the spread of falsified medicine, and that's particularly worrying in Africa, where up to about 155,000 child deaths annually are due to falsified anti-malaria drugs, and a similar number of children are dying from acute pneumonia after treatment with either falsified or substandard medicines. So if we were to translate that burden of that 10% burden into economic cost caused by loss of life, among other things, that burden is between 10 and 200 billion US dollars. So it's really mind boggling. And I think some of these facts are, are just not known. So we really fight the fakes it needs to get these on in front of the policymakers. The falsifications, of course, are reported across many therapeutic areas. Anti-malarials, probably the biggest category, but also treatments for non-communicable disease, such as diabetes, cardiovascular disease, cancer, antibiotics, HIV treatments, and a subject which many of my co-speakers have spoken about today, vaccines, of course. The evolution of antimicrobial resistance is really a major peril from poor quality drugs due to microbial selection and geographical spread. And this effect is really not completely known. So something that we need to look into a bit more. So this is really a major challenge to deliver healthcare worldwide. Now, to really get a better view of the problem, the statistics that we have show that between 2013 and 17, Africa accounted for fully 42% of the known substandard and falsified medicines problem globally. But the issue is that WHO relies on regional regulatory authorities around the world to notify of seizures. So that data is only as good as the surveillance and reporting in the countries concerned, which we know are lacking resources. So the problem is unfortunately even underestimated. So this shocking figure has really several causes. There are weak or inconsistent legal and regulatory frameworks in the countries that need to both address sales and production of medicines. And frequently, citizens who just have fewer resources, frequently rely on street vendors, markets, and where there's a great risk of buying fakes. Another big issue is that malaria is so affected by fake medicines is that in the regions where malaria infections are rampant, such as the northern part of the Latin American continent, sub-Saharan Africa, and Southeast Asia, those are where fakes are most commonly found. And so that means that anti-malarials are particularly affected. But in other developed countries, fakes are finding their way into patients' hands via illegal online pharmacies or sellers. And we're really increasingly concerned about that. I'll be talking a little bit about Interpol, who's been working a bit on this issue, because we don't have many ways to police the commerce on the internet. And a lot of people sort of naively think that they're saving money, but don't really fully realize the risk. So we need to better inform and find ways of protecting patients and health systems. So obviously, to bring the problem back to cardiovascular disease and the World Heart Federation's commitment to combating fake medicines, we have at the age of 50, there's a very high likelihood that you will contract some risk factor associated with cardiovascular disease. It's a little over half in men and almost 40% in women. 18.5 million people die from cardiovascular disease each year. So it's more than any other cause. It's about a third of all deaths. This is all just to drive home that cardiovascular disease therapies are among the most widely prescribed. And once you're prescribed typically statins or antihypertensive medicines, you tend to need to continue to take those drugs until the end of your life. So this makes these, a very, very major class of medicines, and ones that are, I would say, very subject to falsification. What the WHF has done is that since sub-Saharan Africa, we're talking about low and middle income countries for the most part, are very, very severely impacted. We are integrating the fake and substandard medicines theme into our work. And for example, in late 2020, we released a report that you see a picture of here, a call to action on access to essential medicines, where we call for greater policymaker commitment and the use of artificial intelligence and digital tools to combat this issue. So I invite you to visit the World Heart Federation website to have a look at that. Also, those with cardiovascular disease risk factors are more vulnerable to COVID-19 and need to be high priority recipients of vaccination. Falsification of the vaccine, unfortunately, will result in additional unnecessary loss of life during this prolonged and very damaging pandemic. So, as a word about falsified COVID-19 vaccines, this is also an issue which is particularly of concern to us at Fight the Fakes. So falsified COVID-19 vaccines have made their appearance on the dark web and on the streets. They didn't even wait for the first vaccine to be approved by regulatory authorities in late last year in order to begin promoting these fakes. And they're really putting the health and safety of people at risk. So Interpol has issued an important warning about criminal networks who are distributing fake vaccines and medicinal products, typically that tout, prevention capabilities, and they're trying to dismantle these. Additionally, the World Health Organization issued a medical product alert directly showing the falsification of the first COVID-19 approved vaccine from Pfizer-BioNTech. Another very important point to mention here, as I've been talking quite a bit about the African subcontinent. Recently, Dr. Margaret Agama Anayete, the head of Health, Nutrition, and Population Division in Africa of the African Union, she stressed during the African Union Summit that the continent's been flooded by fake medicines for COVID-19 and related medical products. And this just makes the ratification of the African Medicines Agency imperative as a unified regulatory authority that, believe it or not, to date does not exist in Africa, would protect citizens from falsified and substandard medicines and ensure better access to safe and approved medicines. And this is really, a minimum level of healthcare that everyone deserves. So what are we at Fight the Fakes doing concretely? So you see here some of our members who have joined the initial alliance since the end of last year, and that's there are 16 right now, and it's growing quite quickly. But 7 years have passed since Fight the Fakes first began its activities as a grassroots advocacy campaign, and we just created an NGO based here in Geneva independently in December. And this new formal governance structure will allow the Alliance to take the fight against substandard and falsified medicines to the next level. So our members that you see here are representing healthcare professionals, manufacturers, wholesalers, researchers, and patients. So we're really representing all of those constituencies, gives us a really unique position to scale up and prevent falsified medicines from endangering people's health and well-being. So mainly our activities will be to conduct advocacy and awareness raising efforts. So we really thank GS1 for giving us the floor to talk about this, but we also heavily engaged on during WHO events as well. And of course we have an awareness week, Fight the Fakes week, the first week of December. We're also strengthening the capacity of organizations working in the area of medicines quality, and we're doing a lot of education efforts. We're very close to pharmacy students and have gotten fake and substandard medicines on the curriculum, which is something that wasn't the case. So our ultimate goal is really to create a global movement of like-minded organizations to ensure that this issue really stays at the forefront of the attention of policymakers. And we plan quite a number of activities as well in May for the virtual World Health Assembly of the World Health Organization. So securing the global medicine supply chain during the pandemic is extremely important. And of course, the GS1 standards and standard benefits and value have really helped to, I'd say, raise the bar in that area, because the pharmaceutical industry has really worked diligently with all supply chain partners, government authorities around the world to prevent fakes from entering the supply chain. So the medicines distribution system in the developed world basically all utilize the GS1 standards as a tool to provide a reliable, safe, and secure distribution system. But in other parts of the world and developing countries, governments really haven't yet focused on regulations and distribution systems, or they're doing that in very, very early stages. So there, the risk of falsified medications entering the market is extremely high. We really need to, one, support the creation of the African Medicines Agency, but also this partnership between GS1 and Fight the Fakes is very important so that we can, I would say, disseminate these standards so that they are not limited to the developed world. So really, this is extremely important. We've been talking, the speakers who preceded me today have been talking also about delivering the COVID-19 vaccines to populations and having processes that really allow us to closely monitor the distribution, make sure all stakeholders are involved, to really use standard criteria for that is extremely key. And an example of Fight the Fakes member engagement in this area is a position paper that was issued by one of the Fight the Fakes members, the International Federation of Pharmaceutical Manufacturers and Associations, on the identification and traceability of medicinal products. So the work is focusing on 5 principles for the successful implementation of traceability systems to the supply chains of medicines, and reflects the latest standards and innovations in research and development for serialization and traceability. So it can be quite a technical work, but I really recommend that you consult the IFPMA website to get to read that that position paper. Very important to our industry. So Obviously here, I'm sharing with you the objectives of Fight the Fakes, which is obviously to create a movement of allies, leverage opportunities for action, promote the implementation of initiatives, and strengthen the capacity of organizations, particularly through educational activities. And our membership already counts a number of academic institutions who are very important to that goal. So we challenge everyone to really think critically about the dangers of substandard and falsified medicines and to try to imagine a world free of fake medicines. Um, so, really, what can you do to help us with this? Because we are an embryonic organization. We've just started our activities, but we're going to be ramping up initiatives on awareness, fundraising, policy engagement, trainings, issuing publications and events where we can promote the implementation of all initiatives that fight fake and falsified medicines. So please join us in our efforts. Follow us on Twitter, like us on Facebook, and always use the hashtags, hashtag fight the fakes, which helps to rally interest around our cause. And, tell all your friends and families and anyone you know to alert as many people as possible to this worldwide threat and ensure that they're particularly vigilant about where they buy their medicines and will really help to combat these criminal organizations which are taking a huge toll on global health. So that's all I have for today, and I really thank you all for your attention. So I'll pass back to you, Geraldine.
Thank you, Andrea. It's me, Ulrike. Thank you very much for